I think it could do, but it has to be tailored to the patient and also to the country. Every country, every patient is different. I think the word contract is definitely not a good word. I think alliance sounds a lot better, because that means that both the patient and the doctor are responsible. The advantages that I see are an improvement of adherence from the patient. It's also a good follow-up tool, I think, for both the patient and the doctor, the physician. It's also a good preparation tool for coming to your next doctor's appointment, to reread things. And it creates also time for both the HCP and the patient during the actual meeting. Now, disadvantages could be it's a lot of paperwork, or it could seem like a lot of paperwork. And maybe some people would say, who is going to be accountable? Is it the patient or is it the doctor? I feel that the patient is ultimately accountable, so the responsibility has to be clearly stated. I think giving information would be very important. That's, I think, one of the key things that they should do. So pros and cons also for medication maybe, because there's so much medication on the market at the moment. And as a patient, you don't really know which one to choose. So it is helpful to see what are the pros and cons, but maybe even hear from other patients. That could be testimonials. That could be helpful, and I think an MS league could, or an MS center could help with that. Also, explanation again of medical terms. I think that is something on every level should be looked at. And like I already said, quotes and experiences from other patients could really help making a choice for a patient. Yeah, I think, one thing, as I already mentioned a few times, what is MS? Clearly, and an easy way to explain the disease to people. How can newly diagnosed patients or anybody that suffers the disease give it a place in his or her own life? What can the person do to deal with MS could be another one. And I think another important part would be information for family, peer groups, and potentially employers even. And the last thing I thought of, which is not often mentioned, is the risk-benefit of medication. Because you start on a specific medication, and I think it's also interesting and important for a patient to know what the risk and the benefits entail.